navigate through some stressful times, and so those are things that are all good things.
Number one, I wanted to compliment Hospice Hospice because I did use them when my brother was in the nursing home. I don't know if this has ever happened to anyone else or not, but it happened to my family. My brother was in the nursing home for almost 2 years, and he complained of having a cold, and they treated him, he complained of having really bad chest pains. They treated him for a cold because he had never shown any history whatsoever of having any heart problems. So we didn't know he had had a heart attack until 2 months later. And that's when he got really, really sick. So I was in the hospital with him, and they gave me the diagnosis and everything, sent me to a specialist for heart and so forth. I went to him, and I talked with him privately, and he said, we felt like the family had already met, and we felt like hospice was what we wanted, and we did. So we went back to the nursing home, told them that we had Bunch Towards Hospice coming in. I had a fight on my hands. They refused at first to let me have it, so I had to call an advocate in that said, you let hospice come in or else. And they did. So you have to be your own advocate, and preparing this ahead of time is the best thing that you can do, because we thought my brother was doing fine because they told us, he just had a cold and he's okay. Then he got death again. So anyway, you need to check things ahead of time. One other quick thing, File of Life on your refrigerator is the best thing you can do. And you can get them in lots of libraries and so forth. Put the sticker on your front door so they know when they come to your door that you have that on your refrigerator.
I'll bring something next week.
Oh, good.
And I will say, some facilities are funny, as you learn, about hospice coming into their facilities. You do need to be their advocate. Now, I will say some of them are contracted with certain hospices, that's who they use. But I think you can probably, if you wanted somebody different, you can probably get somebody different if you wanted to.
There is an advocate, and they had it posted in the nursing homes in certain places where if you feel like you haven't been treated fairly, you can call this advocate. My sister happened to have been a registered nurse. She knew exactly who to call. I made one phone call. The girl was there within 30 minutes and met with us at the nursing home, and they said, okay, yes, you can get funds towards hospice.
And I think the other thing is, since we're on this kind of hospice theme right now, is sometimes people think when you go into hospice, oh, they're going to stop all my medicines, and it's going to be it, and that's not accurate either. Whether it's going to load me up with morphine, I've heard people tell me that. So you're just going to give me morphine, and that's not accurate either. And so I just make sure that people understand that anything that's going to be we would use to try to make sure that that person's comfortable, we will continue as long as they can take the medicines and continue to swallow the pills or whatever they are. Absolutely. So
they were great to us. They were there like every other day or whatever, and met with us and talked to us. And they, one of the clergy even, when my request, came back and did a small memorial service at the nursing home so that the people that couldn't go to the funeral were able to have a service. So that was great.
Well, I had a family member who, and not to talk about doctors, but some of us might have experienced that. If you see a lung doctor and you see your lung doctor, if you have a cardiac doctor, sometimes they, back and forth on what to do. And it's true, they do fight. And that's just so good where palliative can come in and help balance that and alleviate that stress on our part as a family member or the patient. And that's what he's saying. That support is so, so important. But I had a situation, I had an aunt, and I wasn't really sure she was going to pass away in 6 months. And we were really fighting, not fighting, but we took her to one place. She had these blisters. She had lymphoma. She just wasn't going to get better. She was still fully alert. And I called one of your partners, Dr. Booth, only because I met her. And I asked for a favor because, her basic B was out of the country on a mission trip, and this doctor said, well, I can't help you with this, or it's be 2 weeks before I see you. And we ended up, she did see her a couple of times, and this Dr. Booth wanted to assess my aunt, and they finally decided on hospice. And she lived like 4 months, but she was, like you said, she got better. You know, to where sometimes people question, oh my gosh, do we pull the gun and say, oh no, it's too quick. But because we weren't running her back to the hospital anymore, all the family could come, we took turns. She had a day person, my husband was able to pay somebody to come in while Mary Ann was able to maintain her teenagers graduating from high school. It was such a peaceful thing. And, you know, but I know that I've seen that 1,000 times, which said, oh, they're better. Maybe we should have called hospice in, but Dr. Flickinger's right, he's not pushing hospice. It's because that stress is alleviated. And that's why I'm such a believer and an advocate, like she says. Everybody deserves to have a family member like her that'll fight for you. So it is very true, but the palliative, you don't have to wait till, you know, like I said, he can help manage with just if you get frustrated with all the different things that you're kind of fighting back and forth with. And then, you know, and I don't think anybody here is ready to make that decision, but you probably have a family member or someone else. You know, the more education we know about this, I think the better off we are.
How long does it take to get someone info?
So,
Wait for an appointment or whatever?
yeah, but usually, I can tell you usually within 1 to 2 weeks, because we're kind of, the outpatient side is really kind of blossoming. So we've added another physician to the outpatient side and a nurse practitioner to the outpatient side. The nurse practitioner's not quite up and running yet, but the physician is, and it depends where you live, what's easier for you to get. Yeah, so Memorial now has an outpatient team up there as well. So, yeah, they just opened their clinic.
I need one tomorrow.
You need one tomorrow? Man, now I'm a little stressed.
You can get one tomorrow.
They get one tomorrow?
Yes, you can get one tomorrow.
Okay.
I will, I can leave your office.
Today we put in hospice, I'm not ready.
What's that?
I'm not ready for hospice.
Yeah, but for palliative, yeah, we have a palliative team at Memorial, and they have an outpatient clinic there now too. So, the physician that works up there, literally that just got opened here in the last couple of weeks. I don't want to say which days exactly she's up there. I think it's Monday and Tuesday, but I don't know that 100%. So,
Typically, does your own doctor ask for a consult?
yes,
Her question, she's gonna ask me one.
yeah.
But it usually,
Yeah, consult has to be generated typically, so usually, and that can come from your primary care, it doesn't have to come from your primary care provider. Like we get a lot of consults from the oncology team, as you can imagine, because we kind of work hand in hand a lot. And so a lot of our consults come from the oncology team. Your pulmonary doctor can do it, you know, your primary care doctor, so it doesn't have to be the primary care doctor. But yes, so a consult gets generated just like you would generate any other consult to come see our team. For any other provider or subspecialty.
Does the VA have anything like that?
They do have I don't know if they have outpatient, I know they have an inpatient palliative care unit at the VA. I don't know what exactly their setup is from the outpatient side of things, but yes, they
have
do.
inpatient hospice.
And they definitely have inpatient hospice as well at the VA. And I know they have palliative care providers down there because I've seen patients at St. Francis that were being seen there. And so I know, I just don't know how they're set up, like if it's set up similar to us. They have sent outpatient people, inpatient. I know they have an inpatient unit because I've had patients there as well. So
And that is a wonderful unit over there because it's set up like, similar to what you described as the house over here. Big kitchen, they definitely want family there involved. They want you to continue your normal life and so individual rooms.
And you also have to have a doctor say that you have 6 months to live.
for hospice, not for
Yeah,
palliative.
inpatient hospice at the VA.
Right.
And you have to have family. You can't come in like Miss Mary where you don't have any family. They won't let you in. So you have to have family and the family has to participate actively.
You talk about hospice, you're talking about right now. Or were you talking about hospice, is that what you mean when you say?
Hospice at the VA hospital.
Oh, at the VA, oh, okay, I'm sorry, yeah, that I don't know, okay.
I know at the VA,
Yeah.
you do have to, because I know, a person that's old.
And I will say is if there is a hospice consult, one of the, and you bring up a great point, one of the questions they will ask is what is that patient support system? Like what's gonna happen to try to support them? And that sometimes gets a little dicey as far as you said, will they take you onto their hospice service? I tend to lean to always taking people on because somebody's gonna need to support them. And so then we just need to figure out a safe mechanism to make sure they have that support.